Hello everyone, I'm Himanshu. I'm a gynecologist and fertility specialist in Hertfordshire. Welcome to our channel. If you like the information, please do like the video and subscribe it so you can be updated about our new videos about women's health issues. Today we are going to talk about endometriosis. So you are either diagnosed with endometriosis or you suspect that you might have endometriosis, or you are someone who just wants some more information about endometriosis. So what is an endometriosis? So when tissue, the lining of the uterus is called endometrium. And when a tissue which resembles endometrium is growing outside the uterus, most commonly in the pelvis, and in rare cases, it has been shown to grow in other parts of the body. And when it grows, it can lead to different symptoms, and it's a complex of various symptoms, and then it leads to a condition called endometriosis. So what are the symptoms of endometriosis? So these can be painful, heavy, irregular periods, pain before, during, and after periods, spotting after intercourse, pain during intercourse, and sometimes when it can involve bowel or bladder and ureters, then the symptoms related to it. Now, how this condition affects women. So the symptom complex varies from patient to patient, as and in the same patient depending on different stages of their cycle. So the symptom can vary from mild to severe, which can affect the quality of your life. Obviously, because of the pain during intercourse, it can affect your intimate relations, and obviously it can affect your fertility. Now, how do we diagnose this condition? So obviously you need a full history and an ultrasound scan. If you're interested in fertility, then we look at the fertility potential as well. And sometimes based on your history as well as scan findings, we can suspect that you have endometriosis. However, laparoscopy is the gold standard investigation where we can actually diagnose as well as treat endometriosis at the same time. In smaller percentage of cases, they developed an ovarian cyst, excuse me, which is called an endometrioma, where old blood collects into the ovaries and appears as a cyst on a scan, where we can diagnose it based on the scan. However, laparoscopy remains the main way to diagnose and treat endometriosis. So it has been divided into 4 stages. Stage 1 means just some mild deposits. Stage 2, deposits in more than one place. Stage 3, where the endometriosis has led to scarring and some sort of a complication like fixing the ovaries to the pelvic side wall or affecting the tubes. And when the bowel gets involved, it automatically becomes stage 4 endometriosis. We call it disease of theories. There are plenty of theories, but we still unfortunately don't know exactly what causes endometriosis. But the most accepted theory is retrograde menstruation. So whenever a woman menstruates, the menstrual blood will come out of the vagina. But with retrograde menstruation, which all women have, but we still don't know why one woman should develop endometriosis and some shouldn't. So the menstrual blood escapes into the pelvis, and then the cells will lodge on the ovary because they're right next to the tube back of the uterus due to gravity, and involve the surrounding organs once they start growing there. And when they affect the wall of the uterus, it is called adenomyosis. How it affects fertility is obviously with the pain during intercourse, women won't have intercourse as often as they normally would. It is shown to affect the quality of the eggs. Sometimes it produces some toxins which don't allow the fallopian tube to carry the egg successfully. So it works at multiple levels and can affect your fertility. what are the treatments for it? So there are medical treatments and surgical treatments. The medical treatments are basically thinning out the lining of the uterus with the help of the hormones. So people who are suitable, they're offered combined contraceptive pills which contains estrogen and progesterone. But if that's not possible, then mainstay of the treatment is progesterone in different forms. So it could either be mini pill or a depot injection or an implant or a Mirena coil, and in rare cases we give something called as GnRH agonist or antagonist to shut down the ovaries for a period of time to create an artificial menopause to reduce the growth of the endometrial like deposits outside the uterus. If you're trying to get pregnant, unfortunately the hormonal treatment won't be very helpful because they will work as contraceptives, hence surgery would be the better option. There is some research which suggests that in stage 1 and 2 endometriosis, treating them does improve your natural conception rate as well as helps you in having a successful IVF cycle. Stage 3 and 4 require a bit of more surgical involvement with either bowel surgeons or urologist depending on the cases. The best thing is, if you are suspecting you have endometriosis, please maintain the log of your periods. There are plenty of apps available, and monitor if you're having heavy periods or painful periods or spotting for more than 6 months. It will be better that you get a specialist advice. The duration between presenting with the symptoms and getting a diagnosis is unfortunately quite long, almost 8 to 10 years in the UK. And by that time, the effects can be quite devastating, especially if you're interested in fertility. If you need any more information, please do visit our website www.heartsfertility.co.uk. There are patient information leaflets, and there is a new venture we started. It's called Hearts Health Hub, where if you become a member, your scan, consultation and treatments will be at discounted prices. And if you feel that somebody will be helped with this information, please feel free to share the videos. Thank you.